The video starts by kind of going through the bones melting away, and then kind of taking you around the chest on the outside. Anything in yellow that you're seeing is COVID infected, destroyed lung tissue. What struck me, almost right away, and, for somebody, especially for someone who's been in practice for almost 20 years, is just kind of the extent of the lung damage. So, in the past, this has been compared to, your garden variety pneumonia. It's been compared to the seasonal flu. And one of the things we need to get across, and we try harder and harder every day, is that this is nothing like the seasonal flu. This is not like your typical pneumonia. A typical, let's say, bacterial pneumonia would typically affect, one part of the lung, perhaps, one lobe of the lung. And again, as you can see in the video, it not only affects both lungs, but affects various parts of each lung. So it's pretty diffuse damage. And the other thing, the caveat in all of this too, is that the images that you were looking at, the video that you're looking at, is based on the CAT scan that was performed before he got so sick that he had to be intubated and placed on the ventilator. So if you were to repeat that CAT scan perhaps 48 hours later, chances are you're going to be seeing much more yellow than you actually are, that things would be even worse. About halfway through the video, we do what's called a virtual bronchoscopy, where now you kind of get the bird's eye view and you start going into the trachea, into the major airway, and then you go down into the right lung. And now that you're actually inside the right lung, you're kind of seeing some of those yellow areas, up close and personal. This was a 59-year-old gentleman who did not have, you hear a lot about, this only affects elderly patients, or somebody who's got lots of other medical problems, or is immunosuppressed. And the more and more we learn about, our experience here in the U.S., the more we know that that's not true. We know that, the elderly, immunosuppressed, patients with a lot of medical problems are more severely affected, but the disease is not limited to them.